Welcome to the William G. Rohrer Cancer Genetics Program. It is our pleasure to meet with you today, and we thank you for choosing our program for your care. You are about to view a short introductory video in preparation for your visit. During this presentation, we will review the basics of cancer genetics, genetic testing options, types of genetic testing results, and what you can expect if you choose to move forward with genetic testing. First, we would like to review the basics of cancer genetics. Genes provide instructions for how the body should grow and develop. Changes in genes, known as mutations, cause the gene not to work properly. When certain genes are not working properly, this can lead to abnormal growth of our cells. This abnormal growth can lead to cancer. While all cancers have genetic mutations, most gene mutations and most cancers are not hereditary. When we discuss genetic testing, we will be referring to genetic testing performed on healthy cells, looking for hereditary cancer risk for the benefit of you and your family. We will not be referring to the type of genetic testing called tumor genetic testing that might be ordered by an oncologist to look at genetic changes in cancer or tumor cells as a part of cancer treatment. If you are watching this presentation, you may have been diagnosed with cancer, you may have a family history of cancer, or both. Your healthcare provider may have recommended that you consider genetic counseling and testing for hereditary cancer risk. You may be wondering why people have genetic testing done for hereditary cancer risk. Genetic testing may help to explain why cancer is happening in a person or family, guide medical treatment or care, clarify future risks for a person to develop cancer, and clarify future risks for a person's children, siblings, and other family members. Most often, environmental exposures, aging, or other random chance cause mutations in the genes that lead to cancer. This is called sporadic cancer, and is the most common reason cancer develops. Acquired gene mutations cannot be passed on to children or shared with other family members. However, some families do have a gene mutation that can be passed on from one generation to another. Mutations in these genes are present from birth and can make it harder for the body to prevent a cancer from developing. This is called hereditary cancer and accounts for approximately 10% of cancers. Certain features can suggest that a family has hereditary cancer, including the following: an individual with a cancer diagnosis at a younger than average age for that cancer type, usually before age 50. A person with more than one separate cancer. Specific or more rare cancer types. Several blood relatives having the same or related types of cancer. Results of pathology testing done on a tumor that suggest hereditary cancer. Results of genetic testing done on a tumor that show a gene mutation possibly related to hereditary cancer, and ancestry that is more likely to be linked to hereditary cancer, such as Eastern European Jewish background. Genetic testing may be recommended by your healthcare provider if you and your family have these or other features of hereditary cancer. To help determine whether a family may have hereditary cancer, your genetic counselor will collect a family history chart, also called a pedigree. This is an example of what a pedigree might look like. There are three possible results of genetic testing: positive, negative, and uncertain. We will talk about each type of result in more detail. When a laboratory finds a mutation in a hereditary cancer gene, this is called a positive test result. This means there is hereditary risk to develop cancer within the family, but the specific cancer types and risks will depend on which gene has the mutation. It is important to note that not everyone with a mutation will develop cancer in their lifetime. If you have been diagnosed with cancer, a positive result may explain why your cancer developed and may guide your treatment options, such as the type of surgery or chemotherapy. A positive result may also give you information about future cancer risks in order to guide cancer screening and risk reduction. The chance for blood relatives to have inherited the same mutation will depend on whether they are close or distant relatives. The closest relatives, such as children, parents, and full brothers and sisters, will have a 50% chance to have that same mutation. Test results could also be negative. This means that the laboratory did not find a mutation in any of the genes tested. A negative result does not mean there is no cancer risk, but rather your cancer risk will depend on your family history or your own risk factors. In most cases, a negative result will not impact your medical care. If there is a known mutation in the family, and you test negative for this mutation, then your cancer risk may be closer to average. However, if there is a family history of cancer, a hereditary cause for cancer may still be present in the family. Other blood relatives may consider genetic evaluation and testing, especially if they have been diagnosed with cancer themselves. The third type of test result is called a variant of uncertain significance. Everyone has changes, or variants, in their genes, and most of these variants do not cause health problems. An uncertain result means that the laboratory does not yet know if the variant detected in an individual increases their risk for cancer, or if it is just a part of the differences that make us each unique. Until researchers learn more about whether the variant leads to increased risk, medical decisions should not be made based on the result. Relatives should not be tested specifically for a variant because it is not medically helpful. In summary, if you receive a positive result, you should work with your healthcare providers to change your medical management as needed. Genetic testing is also available for family members who may be interested in testing for your positive result. On the other hand, a negative or uncertain genetic testing result will not change a person's cancer treatment or risk management. In this case, a person's management should be based on personal and family history risk factors, as well as their healthcare provider's recommendations. Almost all genetic testing is performed using a blood or saliva sample. There are several types of genetic tests that can be performed. These can include testing for a specific genetic change, a single gene or syndrome, or a panel of multiple genes. Your genetic counselor will discuss which type of testing may be most appropriate for you. Multi-gene panel testing is when the laboratory tests for mutations in several different genes. Multi-gene panel tests can look for mutations in genes that increase the risk for a specific type of cancer, such as breast cancer, or use a larger panel to test for multiple types of hereditary cancer. Multi-gene panel tests can look for mutations in genes with different levels of cancer risk. National Cancer Risk Management Guidelines are usually available for genes that cause high or moderate cancer risks. Mutations in hereditary cancer genes can increase the risk for multiple different types of cancer. For example, mutations in BRCA1 and BRCA2 can increase the risk for male and female breast, ovarian, pancreatic, prostate, and melanoma skin cancers. Another hereditary condition called Lynch syndrome can increase the risk for colon, uterine, ovarian, stomach, and other types of cancer. Genetic testing is often covered by health insurance if medical necessity criteria are met. Some genetic testing laboratories will check on a patient's insurance coverage and any out-of-pocket costs before the testing starts. If a patient appears to have a high out-of-pocket cost for testing, the laboratory may be able to offer the patient a discount based on financial need. A different option is that a patient may choose to pay a laboratory directly for genetic testing when they do not have health insurance or do not want their health insurance billed. This is called self-pay, the amount of which can be as low as a few $100s for select laboratories. If you choose to have genetic testing after genetic counseling is done, the following includes the typical process once your sample has been collected. First, the biological sample is shipped to the laboratory that performs the genetic testing. The genetic test results are typically completed in about 3 weeks after the test is started at the laboratory. If the test result is needed urgently to make decisions about treatment, it is sometimes possible to receive the result within 2 weeks. Results are then sent to the healthcare provider and genetic counselor, who will review the results within the team and then return the results to the patient. Results are included in the medical record and may influence medical decision-making. You may wonder whether the results of genetic testing could impact your health insurance or other types of insurance. A United States federal law called the Genetic Information Non-Discrimination Act, or GINA, protects most unaffected individuals from employment or health insurance discrimination based on the results of genetic testing. GINA does not prevent discrimination in life insurance, long-term care insurance, or disability insurance. We hope that this presentation was helpful in preparing for your visit. The Cancer Genetics program team will be in shortly to continue your visit.